Hello, hope you're having a good week. The two topics for this week were topical medications and pain assessment. So you've learned a little bit about pain assessment as you've kind of come along in the program so far. So that isn't necessarily a fully new topic for you. Topical medications, though, will be something that is new for your learning this week. If we start with topical medications, I want to just remind you that those types of medications are going to be anything that we apply to our skin, to the nose, the eyes, the ears, the vaginal canal, or the rectum. Okay, so any type of medication that is administered into those areas is going to be a topical medication. Okay, and remember, we apply that medication, so say onto the skin, okay, and it'll be absorbed into the skin and it'll interact with the area in which it is actually put onto the skin, but it also will, as it absorbs into the skin, will absorb into that bloodstream and can have more systemic effects on the patient as well. So we need to watch for those, even with the administration of topical medications. If we look at inhalation as one area that I just wanted to kind of go over, we have different types of inhalers. So for example, we have a metered dose inhaler and we have a dry powder inhaler. Okay, so the metered dose inhaler is the one where they push the top of the inhaler, and that creates an aerosol that they then inhale into their lungs. Okay, so the one thing to remember with metered dose is that we do recommend a spacer. Okay, this helps the particles to sort of break down into a smaller size before they're inhaled, which helps with absorption for your patient. Okay, and the other thing is, so if they choose not to use a spacer, okay, we're going to tell them then that they can either have the inhaler 2 to 4 centimeters in front of their mouth, or they can put it in their mouth with their mouth closed tightly around the mouthpiece. When we ask them to take the medication, we're going to have them first exhale. Then they would depress the canister on the top to create that aerosol. Then they would inhale the medication into their lungs and hold that for 10 seconds. Okay. Again, if they do use a spacer, their mouth would be around the mouthpiece of the spacer. We would press the container and we would ask them to inhale deeply for 3 to 5 seconds this time, and again holding it for 10 seconds. Okay. They need to remove the canister and the spacer from their mouth before they exhale. A dry powder inhaler is a little bit different. It doesn't create an aerosol. It's a powder that's and administration of that is activated by that patient's breath. So one thing that's nice about a dry powder inhaler, even compared to a metered dose, is that it takes less coordination to be able to administer. So metered dose, you really would have to think about how coordinated that client is in their ability to administer that type of inhaler, versus the dry powder, you would click the medication for the new dose. The patient would then activate it by breathing in and inhaling in the dry powder. Okay. The one thing that you do have to consider with this is that they need to be able to inspire at a speed that is needed to administer the entire dose. So that would be something to consider. And with this dry powder, we're not using a spacer. Okay. So that's just a little bit about the two. I wanted to make sure that you were clear about the difference between them. Okay. The other thing to think about in terms of inhalers is if an individual is using more than one inhaler, okay, we always want to use the bronchodilator first, right? So we want to dilate the bronchioles before we administer the other medications. And so that's why we would choose that one first. And again, we want to leave 20 to 30 seconds in between each administered dose. Okay. The other thing to think about with topical medications for application to, say, the skin, if you're applying a topical medication to, say, an open wound, thinking about infection control principles, we'd want to apply sterile gloves to prevent the transmission of any microorganisms. But if it's just to regular skin with where you're not really worried about that, then you would just want to be using clean gloves to prevent it from absorbing into your own skin. Other skin applications that you see a lot is going to be the transdermal patch. And so those are those little patches that are going to go on, say, arm, and they're generally on for a solid 12 hours, say 8 in the morning, and then they are removed 8 at night. Or some of them can be applied, say, Monday, and they don't come off again until the next Monday. Okay, so you need to really be watching for that. It's really, really important that you're not applying a second patch without the original patch being removed, because then the patient is actually getting an overdose of that medication. Okay, they can be quite difficult to see. Some can be actually fairly clear in color. And different agencies will have different policies about whether they want the date and that actually recorded right on the patch as it's administered. Okay. A lot of times what's really good is to even just ask the patient, do you have your patch on? Where is it located? And you should be checking in on your shifts as well, even if you're not changing the patch that day. So that's really just a few things to point out about topical medications. If we kind of think now about pain management a little bit, post-operative pain you really talked about in lab this week. So one thing I did want to point out is your patient previously had a PCA pump that was discontinued. Okay, and that was discontinued because someone was pressing the button. And so I just want to highlight for you that that's actually something that happens very frequently. Sometimes language barrier can be an issue in that the patient and the family doesn't actually fully understand why and the use of that PCA pump. So you really need to be thinking about that. And if that is, this is not a good choice of pain relief strategy for this particular client, and you need to make the rest of the team aware of that. Okay. The other reason that we see a lot of that happening is really there's a parent or a loved one that's really feeling worried that their loved one is going to wake up in pain, and so they press that button. So with pain management and assessment of pain, you really want to be looking, particularly with a PCA pump, for signs that they're getting too much or that someone else might be pushing it. And I think, that's a point of education with the family and with the patient about, how this is used. And I think, we can't just assume that they've already learned this. We have to sort of do that every shift. I think the other point I want to tell you about for pain is just really working with the client to understand the importance of having adequate pain control. We need pain to be controlled enough for them to engage in those EDLs, to be doing their deep breathing and coughing, because this is going to enhance and improve their healing. Okay. So again, part of that is really education again with the client. The other thing I just want to point out to you as you kind of move forward, and you will be giving meds as you progress throughout the semester, in terms of pain, is just don't fall into the habit of judging a patient's need for pain medication. I think you've probably heard many, many times that the patient is the expert on their pain and their need for medication. I just know I've had an experience with a patient, and she was frequently in hospital for short bowel syndrome. She was frequently on Dilaudid for a lot of pain that she was experiencing in relation to this. A lot of individuals on the floor didn't believe her need for pain medication, felt she was just constantly needing it to feed an addiction. And you know what? It really impacted the way she felt, the way she responded, the way she even wanted to work with different nurses on the unit. So I think you have to really think about that as you move forward, because that's an important part of even just administering pain medication. Anyways, that's just a few things to really follow up the modules for this week. I hope you have a good one.